Missing,
The time now is 10 after 4. I call to order the meeting for the Health and Mental Health Committee of the Orange County Legislature. Please note this meeting is being transmitted by a live stream. The public can find a link to this video stream by visiting the Orange County website, www.orangecountygov.com, and clicking on the tab for the legislature and locating the meeting down on the bottom where it says live stream. Please silence your cell phones, tablets, and the electronic devices. And please also be mindful that the microphones here are very sensitive and robust. If you'll now stand and join me for the Pledge of Allegiance. I pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. Going to have a roll call?
Emo.
Here.
Anagnostakis. Ellers.
Here.
Fagion. Luhan.
Present.
Sutherland. Here. Patel. Here. Chewy.
Here. Okay. First up, we have Commissioner Miller joining us again.
Good afternoon.
You go too far. First up, we have item 1A, request to transfer funds from mental health's advance account to mental health's 2022 operating budget. These funds are from previous years claiming closeouts. Funds will be used to remove all interior wallpaper, prep, and paint entire interior of the building. The amount of $179,695, and that's legislative request number 152. Can I get a motion?
So moved.
Second.
Right, move on to tell. Hey, go ahead, Commissioner.
So the 30 Harriman Drive building is badly in need of a paint job. Really, the wallpaper has been on, I couldn't even guess, 40 or 50 years. Yeah, it is funny because you know how you walk by something and you just don't see it after a while. And then when you stop and look, it's like, we had a 5-year-old say that our building is really creepy. It just really needs a paint job. Not that we should take 5-year-olds only, but no, it really needs to work. We put it in for a capital project. Painting doesn't qualify for a capital project. We fortunately were able to find funds. These are state funds that were issued to us in previous years. The state is typically behind in their closeout. So when they did their closeout, it was funds that were due back to us that we can now be expendable by moving them into our operating budget. DPW has been very supportive. They did a quick professional estimate to come up with this number. We don't know, shouldn't cost more than that, but it should cost something up to that. And it's really needed for the space. The building works very well for us. We just had with the help of DPW again, the boiler replaced, and that was quite a project. But we're looking forward to having this done and some other capital projects just.
And will they, DPW be doing this work also?
It's here, but no,
Right.
no, they will contract out for it. It's a pretty big job.
Okay.
I think it probably needs to be a weekend job too. I don't know what that means, because we're in the offices. I don't know what, sort out the details of that. It's really a matter of just getting the approval to move the fund over, and then we'll get a real estimate
Okay.
and decide with DPW
So we'll
support.
hear about it down the road a little bit.
Yeah, you can come visit.
Okay. Any questions?
Right, it won't look like $100.
That's your old homestead, right?
I'm still there. I have offices, one in Corey and one in 30 Harriman. So I go back and forth between the two offices.
Any questions or comments?
Long
The
time.
history,
Yes.
I'm sorry,
Any,
you're just convincing, I'm sorry.
just, okay. There's no other questions. I'll call the vote. All in favor, aye?
Aye.
All opposed? Unanimous.
Staff will be
Okay.
very.
Item number 1B, monthly update.
I apologize. As I said, I was in Saratoga and I literally did very few emails yesterday, so I missed Doreen's reminder. She has it electronically and will send out to the legislators not present, but this is my hard copy update. National Suicide Lifeline, 10-digit number, went live with a 3-digit number on Saturday. They anticipate, they received about 3.6 million calls last year on the National Suicide Lifeline. That is up 19% from the year prior. They anticipate that they will have a 50% increase with a 3-digit number. Not to mention, the number is being marketed differently. So it's National Suicide Lifeline. It's being marketed as a behavioral health line, similar to our 311, which we had in place 3 years ago. But it's being marketed as a mental health social support, suicide support and prevention, and substance use disorder support opportunity.
Someone in crisis doesn't have to dial 10 numbers.
No one has to dial 10 numbers anymore, just like 911. And in fact, our 311 call center operated by the Mental Health Association, they already took the Lifeline calls. So where other counties, Dutchess is picking up some other counties are not prepared yet to answer their own calls. We will answer a 988 just as we have the 10-digit
And you
call
can tell the
numbers.
difference where it's coming from, obviously.
Yes, they can. Brendan, Casey, and I went back over just a little bit this morning. I just want to confirm, because I do believe they separate out those calls. In fact, I think they even ring differently on our phones, but I just want to confirm that. They did say, though, that they did not have any increase, and let's see, so they can tell the difference in 988 calls. So,
And,
not yet.
is there any kind of projection yet, or is it too soon to see about numbers? Because we need to get some more operators or
They gave us,
more staff?
New York State gave them, I should say, Mental Health Association, $120,000 to hire additional staff. You know, our challenge is space, it's systems. They are hiring additional staff, and Brendan and his team have been so supportive. But who would have anticipated 46,000 calls last year received through the call center? If we have an increase of 50%, in fact, New York City did report a 50% increase in calls over the weekend, then we are definitely going to need more call takers.
Keep us posted. Legislative talk time.
Thank you. Sure. Does this replace 311 or both still operational?
We continue, because it's our Orange County experience, we continue to advocate support marketing the 311 number. 311 call center answers 988 calls.
Right.
And it doesn't matter. If they call 988 or they call 311, it doesn't matter, as long as they know how to get in touch when they need help. That's the key. So both, they can call both.
They can call both. So this is not being, 311 will still be operational, it's not being replaced.
No,
Okay.
no,
And
no.
and
it's-
988 is suicide hotline only, whereas 311 could be any problem in the county that they already have.
They expanded 988. So they expanded 988 and it matches the messaging around our 311. So it's all inclusive
All
support now.
inclusive now, okay.
Yes. It's really to reduce stigma, to reduce bias, to connecting, to give people courage to reach out, and a number that's easy for people to remember.
So
So
you can't believe everything here in the news. I heard that it was just suicide.
it was, it did used to be as the suicide lifeline, that 10-digit number. Yep.
Yep.
And now that they have gotten a 3-digit number, they've expanded what the uses are for.
Okay, thank you.
Should be good. Just to know, we're ongoing. I'll just throw the Healing Communities. You, legislator, will be joining us tomorrow for our opioid settlement fund meeting, right? So that should be exciting. Really, we're hoping to have an opportunity where we can come down with some priorities and begin looking at putting proposals out. We don't have the funds yet, as we talked about at our last meeting, but we want to be prepared when they do come in. MOU has been agreed upon with Goshen School District, and we're putting in the application for their satellite. Hiring. Really excited, like, for example, Middletown Police Department is looking forward to having a peer co-located, so the Assemblywoman Gunther funds. Our agencies are working to hire. It's our challenge across the board, hiring. So they have the money, we have the contract in place, and they're just working to hire the teams. Legislator Tortel will be happy to know I have a cross-system meeting scheduled to discuss how we can support Highland Falls community and their community center. And maybe you just send me their contact information too, or we can join another meeting with them at some point.
Yeah.
is that meeting, I believe is scheduled for next week.
And we received,
Now, this meeting, the cross system meeting is going to be here in Lucian or?
I'm not sure, I think it was scheduled virtual. So Regina, my assistant, scheduled it for me. So it's bringing social services, our community agencies together, peer support services, just to see how we might carve out some hours where we could spend in the community center and be there to support that community.
Yeah, we should get in on that.
so it was, yeah, I just had one thing. So you said the money's in, so this 2-year program, so we got $500,000 that hit.
Something from Gunther's money?
Yeah.
Yes, that's in.
And we get another 500,000 next year.
Actually, we should receive it all.
You got all of it?
I believe we received the whole million, so it's just slated for different years to be
Okay,
spent,
great.
yes.
Thank you.
Sure. Well, they've identified a technical assistant from Georgetown University who will assist us in our 0 to 5 planning, and really a lot of energy and excitement around that work, and those who are already doing the work and those who want to learn more about how they can support that age group. You know, I've already talked about hiring challenges. It's difficult. And having said that, I believe that covers all of my messaging, just the social media messaging that I ask you to always put out, and continue to send 311.
Okay, great. Does anybody have anything else for the commission? That's it. Thanks a lot.
Thank you. Have a good afternoon.
All right, next up, number 2, we have Lawrence Ledoux, Commissioner of Valley View Center, and Donna Strecker, Director of Finance for Valley View. Welcome.
Afternoon.
So Donna, do you want to go first?
Sure. The results we're reviewing today represent the halfway mark in 2022. IGT funding remains unchanged since the last publication. We're at 2.1 million. Emergency disaster funding, we did receive 3.2 million. And on the other revenues, we've received, we've billed 17 million so far. Certainly, we are nowhere near what we would have projected our revenues to be based on our census today and based on the staffing crisis. So revenue cycle management is very challenging for us right now. It's hard for us to grow revenue when we don't have staff to bring in to adequately care for the patients.
And with the emergency disaster, we only had it budgeted at 86,445, and then it's came in at 3.2 million. That was unexpected, obviously, that came in, or what was that specifically for? Was it earmarked for anything?
The way the provider relief funds, it's rolled out in phases. So Valley View did receive under phase 1 and phase 2. I made an application for phase 3. We didn't receive any funding under that, but under phase 4, I did. So the way the language reads, it's really to prepare and respond to COVID. And also it will cover some of our lost revenues. And I do believe, based on the calculations I provided, that's why this number is significantly higher.
Higher from them.
Yeah.
Great.
Yeah.
Nice job.
Thank
Very
you.
good. Sorry.
That's okay.
Yes, this is one of the few positives in our financials, this money that we received that
We found that.
we weren't expecting, so, yes.
Yeah. On the personal service side, we've expensed 9 million. Equipment, we've expensed 32,590. On the contractual side, we have 3 million earmarked for expenditure. We haven't expensed yet. $4 million in expense for contractual. The indirect cost does not post until the end of the year. Employee benefits are coming in at 8 million at the halfway mark of the year. And small amount of serial bond interest totaling 51,000.
Any questions or comments? Any members? Okay.
And I believe the next page you should be looking at looks like this. Yes, okay. So here is an analysis that shows our various bill types and what our census is. In June, our census totaled 68.47. The average census for the first 6 months of the year is 68.81.
Can you say that you could go over that again? Which was this?
Pardon?
This was June's utilization
Yeah,
percent?
June. So on the left-hand side are all the payer sources. And then we show the number of days we've billed. And on the bottom, it's possible days. So that would be 360 beds times the number of days in the month to come up with total days. So if you go all the way over to the right.
Right, yep,
Yeah, you got it. Okay.
thanks.
You're welcome. And the last is the chart showing historical census. Last year, 2021, we were at 79.76. 2022, we're at 68.81 for June's performance, and we averaged 68.81 for the 6 months of 2022.
And your budget processing, if it hasn't started already for next year, will be starting soon. So you're gonna use, what number will you be using then, 70% or? Yeah.
70%.
70%.
Yep.
Okay,
We're not budgeting
And the correlation to that is we're not going to be budgeting for a large number of empty positions. Right,
empty positions.
correct.
Right.
Not layoffs, just empty positions.
Empty positions.
Right.
That are vacated.
Hey, does any committee members have any questions, comments?
I just wanted to say, when you look back at June of 2019, at 95% capacity to now, it's devastating.
It is, certainly, we are
Appreciate
less.
what you guys are doing.
The revenue cycle is being hit, and then you have the combination of the increase in commodity costs at the same time.
That's the killer, it's, you can fill the bed with other people. That's-
Right.
The need's still there, so where you want
Yeah.
to watch your need,
Yeah.
the need is there, but.
That's the scary part.
Yeah,
That's the scary part.
that is the scary part, the need is there, but we can't bring patients in. So we can't grow our revenue until we can stabilize from a staffing standpoint.
Lawrence, you gonna,
My update is short and sweet. There really wasn't much to add for July. We still have the 3 units closed. We went over the census information. We still are accepting short-term admissions. We will accept long-term admissions if we have beds available. So we are monitoring that pretty much daily. Our CHA census is strong. It's 27, which that's another positive. So that's good. We have had employees continue to test positive sporadically for COVID, and we currently have 8 employees out. But no residents are positive, so that's good. None of the units are on precautions. Visitation is still allowed, so that's good as well.
with the CHA census at 27, now what's the number on the staff to handle that?
We only have 2 full-time staff, and then everybody else is contracted staff. So the rehab staff,
How many of those do you have?
what's that?
How many do you have on the contract side?
We use the same staff that provide our in-house rehab, provide the CHA services as well. So it's kind of nice. The therapists that worked with the resident, if they were at Valley View during rehab, they can do the work with them at home as well, which is nice. Yeah, so they continue that relationship with them.
And how many?
And it depends, it all depends on so what happens is when someone is approved to go to the CHOP, the nurse goes out, one of our nurses goes out to do an assessment, and then the assessment, they plug in the numbers on the assessment, it determines how often they should be seen by rehab per week. It could be 2 times a week, could be 3 times a week, and then it also tells them for how long, either for 2 weeks, 3 weeks, 1 week. So it varies between patient to patient, so it's never a consistent number.
And is this 27 basically coming from in-house or?
In-house in both, we have seen an increase in demand from out of
Valley View?
Valley View, which is nice. We weren't expecting the word to get out there so quickly.
Good.
But it's helped us.
Thank you. Any questions, committee members or others? No? Okay. That's it. I appreciate it.
Thank you,
All right.
appreciate it.
Try to stay hydrated and cool.
Yes.
That's the word for the next couple of days for everybody. Thank you.
Thank you.
Okay, thanks.
Yep.
All right, next up, we have number 3, Christopher Erickson, Deputy Commissioner, Health Department. And
myself.
is Brian here?
Oh, yeah, Brian will come up during the,
Okay, when you get to that part, okay. All right, well, first up, we have number 3A. That's a request to accept and appropriate grant funds from the New York State Department of Health for year 2 of 5 of the Creating Healthy Schools and Communities Grant for the period of 6/1/22 through 5/31/23 in the amount of $300,000. Legislative request number 147. Can I get a motion?
So moved. Second.
Sutherland. Luhan. Okay, go ahead, Chris.
thank you, Chairman Tui. This is a longstanding grant that we've had in place for many years. We've worked with the Department of Planning with this grant. The Orange County Department of Health is working with school districts, early child care centers, community settings, work sites, and municipalities on policy systems and environmental changes related to nutrition and physical activity. The purpose of this grant is to increase opportunities for physical activity and improve nutrition in high-need communities of New York State. This currently supports 2 full-time public health educators as well as 1 part-time planner with the planning department.
And that is the grant. Is that coming in before or
It has. This is year 2, I believe.
year 2? I
Yep.
said that.
Exactly.
Year 2. Okay, any questions? Nope, not seen any. Call question, all in favor, aye?
Aye.
Opposed? None. Passes unanimously. Okay, we have number 3B. Request to accept and appropriate funds from the New York State Department of Health for the Public Health Emergency Preparedness Grant for the period of 9/1/22 through 8/31/23 to be used for the opioid crisis. The amount is $72,000. Legislative request number 151. Can I get a
So moved.
Tony? Okay, Chris.
Thank you, Chairman Tui. This is again a long-standing grant that we've had in place. It is helps with the opioid epidemic. The funding comes from the preparedness grant, which of course you guys have heard about previously when I've come here in front of you. This is a little bit of funding that is basically out of that same type of grant. The funding, although it's $72,000, part of that money goes to the mental health peer counseling support group to help support staff person over there. It also goes to buprenorphine training that we do with Crystal Run there to help doctors understand how to use that type of medicine in order to transition people off of being opioid addicted. Although it is a small amount of money, is the type of funding that we do use to go out and also educate. We continue to visit local pharmacies to educate on Narcan and buprenorphine. We distribute packets to local municipalities with information on the 311 center, and Darcy was just here talking about that and the importance of that information. And we do we participated in various pop-up Narcan trainings and distributions there. So we get some of our staff out into these types of things, but we also help support things that are happening in mental health also.
Okay,
This one.
and sure.
No.
Oh. Just would that be possible if you're doing pop-up Narcan training? Could we put something together for the legislators?
Absolutely. I mean, and just for your information also, Darcy's office does do Narcan training,
Okay,
and absolutely, you know, I can contact her or you can reach out to her directly
yeah.
as far as setting up Narcan training for anybody who want. They do that.
So
free of
for,
cost.
between the two, you will get it done.
Yes, absolutely.
Yeah, if you want to spearhead that, we had
Sure.
talked about that before.
Yep,
And
we did it once years ago, but
yeah, so if you want to stay on top of that,
absolutely.
implement it, I'll be happy to work with you.
Thank you, Jill. All right, any questions? Not seeing any? All in favor?
Aye.
Opposed? Unanimous, motion passes. All right,
Brian.
have Brian Fitzwood coming up.
So we did want to give a little bit of update just on what's happening with the medical examiner's facility and construction.
Yep, I have to give, I have to
Yes.
proceed. I have
Gotta
to
do your
get
thing.
the motions, so. 3C, resolution making an increase to the capital projects budget for the medical examiner facility. Funds have already been appropriated to the capital project budget per ARPA, $14 million. ARPA funding legislative request number 179.
So moved.
Legislative. Tell. Okay, go ahead, Chris.
Yes, so as I was saying, this project, we wanted to give you an update on what's happening there also. Although it falls underneath the Department of Health, who is, I guess, the owner of this project. Much of it right now is being run by DPW, right? And the whole process going through there. Thank God. You guys have your hands on that one. Because it involves stuff that is, unfamiliar basically with the Department of Health. So we asked Brian to be here today to help, talk through some of these things. The ARPA funds is part of this right now that we're asking, to increase that in this project. So any questions, or Brian and I are here to.
Yeah, what can you tell us about it? Where are we?
Right now,
What will these funds be used for?
right, so right now we want to increase the budget by these funds, so, excuse me. So right now, we're almost done with design, we're at about 99% for design. We expect final design anytime now to be finalized. We've had some comments back and forth. This is, it's a state-of-the-art building, going to go up by the water tower, up by the DOC, utilize the parking lot up there. It's going to have geothermal heat. It's about 18,000 square feet. Right now, they operate out of their temporary trailer for 10 plus years now. It's about 6,000 square feet, which is wholly inadequate for what they do. So it's going to be up there. There's a lot of family viewing room, special autopsy room, main autopsy room, decedent storage refrigerator, about 40 spaces in there compared to about 10 they have now. 40, wow. Yeah. And we learned during the pandemic, we had 2 temporary trailers on site.
Yeah.
To house the decedents. So we, that's
And
something.
you still have that access to the 10-person mobile or?
Yes, if it was ever needed, we could, we planned where a spot where we could park it right next to the building. It could be accessible and be loaded if
And
we
who's
did run
using
out of
that now?
space.
That's with the emergency services?
That's what emergency services now, yes.
Okay.
They have that temporary
Not
trailer.
being used, right?
The smaller one, I don't believe is being used. We still have a large trailer. that is being
Just in the interim for.
in the interim, right?
Okay.
Because the refrigeration that we have actually associated with the morgue unit is inadequate.
Yeah.
We're especially concerned on days and weeks like we're in right now.
Yeah.
So we have our we have our finger to the pulse, quite honestly, figuring out what's happening.
Yeah.
So we monitor very carefully throughout these time periods, and we want to make sure that we have redundancy in place right now.
And you also have the bigger one that's in backup. the larger one.
Yes.
Yeah, and this building will also have as a backup. It reminds me, it'll also have a standby generator that'll operate the building if something happens.
Yep.
So we, don't have situations like we have now.
Right.
When systems go down. We're also this month, didn't have to come to this committee, but we're going to be at Physical Services to close out seeker for the legislature to assume lead agency. That legislative request is going in also. Bottom line right now, our current estimate is 21 million. So everybody always wants to know bottom line. We're at 21,300,000 for this building. We are waiting for a estimate from our construction manager. They've been on board now for a few months, so they're reviewing the plans and specs. They're going to get us an up-to-date construction estimate also, which we hope is lower than this, but we don't know with the current economy. So
Okay, when do you expect to have that?
within the next month.
Okay, so you'll
Yes.
bring that to a future meeting.
Yes, yeah, because we still have to come back and get more money. The ARPA Part 2, if you will, is, slated to happen in the coming months. So this is just Part 1 of the ARPA money to get this put into the capital.
Right, legislative Lupin.
Mr. Chairman. I believe it was now several months back, I think with Dr. Gelman was here. We had talked about, so the viewing room specifically. About 2 years ago approximately, there was a very unfortunate incident where a person was deceased in a violent crime. And the family had called because they wanted to be able to view their child, obviously. And one of the big issues, my understanding is with the current viewing rooms or the current setup, is that is very, very challenging to almost impossible,
Yes.
especially when a violent crime is usually still under investigation. I want to say that Dr. Gelman kind of addressed that in the conversation, but I just, if in case it wasn't, is that something that is being incorporated in the design plan?
Yes, we have a family viewing room, we have a family waiting room, and we also have a family viewing room.
Good.
And it has what you would see in the movies, it has a glass that would go into the autopsy area so they can view, standing separately in the room.
I'm really happy to hear it because this was a conversation I had at night with the commissioner, and she definitely shared the same sentiments of, families in this hardest, worst moments, to have a trauma-informed space, a space that's really, pays some level of tribute to those guys. So I'm
Right.
really glad that that's being incorporated into the.
Going to your point, right now, we encourage families not to come. We do everything we possibly can to have them not come to the facility because that will last in their memory forever because it's not a place for viewing, it's a work area.
Yeah.
So it's not appropriate for that.
But this new design would be one that would create.
Absolutely, be very comforting.
Good.
Yeah.
I'm ecstatic to hear that because this was definitely something that over the years was one that stayed with me.
Right.
So thank you.
Well, this stayed with a lot of us over the years, and this has been on the drawing board the last couple of years, but before that too, it's been, I think we all were kind of astonished when we saw the conditions down there. Chairwoman and I were down there, and Legislator Tortel, and I don't have a doubt that all of those things are in there, because that's what we're all asking for. And-
Yes.
And the families need it, and they deserve it, and they're gonna get it. So Legislator Tortel.
Thank you, Mr. Chairman. One of the things that stuck out in my memory from the tour was that certain religious groups require that somebody stay with the deceased until interment. Is an area being, is there going to be a place for that? Is that being addressed in the plans, basically? I know you said a family waiting room. Would that suffice those?
Yeah, it would not suffice that. One of the things we still have to where, and we do accommodate that the best we can. These days also, we've had people stay close to the body, like in the parking lot type of thing, and that has sometimes helped to alleviate the situation. We still have to worry about security of the facility because, it is someplace where, possibly crimes could be happening. So we can't have anyone going into a part of the building that potentially could be unsafe or could be contaminating, evidence, that type of thing.
Right.
So we're very careful about those types of things. It will for sure be a more welcoming environment. And as in the past, if we need to make accommodations for someone, but we haven't, for example, put like a bedroom in or anything like that.
I didn't know if the family waiting room was going to be situated in an approximate area that would satisfy those religious requirements.
Yeah. I don't know about that, quite honestly. But I said in the past, we've been able to accommodate that best we can with the situations that we've had.
And when we're in the planning stages and at this point, I think it would behoove us to address it now.
Yeah.
As opposed to waiting till after and saying, oh, well, you're gonna have to, at 10-degree weather, sit outside your car and keep your car running all night.
And I'll check on that because I believe that this conversation did come up previously in some of the planning discussions, and the chief medical examiner and the deputy, I believe, have addressed this. So I will check with them just to make sure that this was addressed. But I'm pretty sure it would have come up in our conversations on this, knowing especially with the architect and designers, of knowing the community that surrounds us.
Chris, can you find that out and then send it to Doreen?
Of course.
So she can let us
Of
all
course.
know
Yeah.
about what accommodations are made
Sure.
for an
And then-
instance like that.
One of the other things that was, that stuck out from the from the tour, numerous things, but was the fact that for ventilation, they were opening windows sometimes if they could. Has the architect considered and have they gone with, stated, because I'm looking at 21 million and I know what some ventilation systems can cost in medical facilities. Is that
Yeah,
including?
Brian, you can talk to that. Yeah.
Including, are we talking about the building or are we talking about the building and the operating systems such as ventilation, heating and air conditioning?
Yeah, when I say 21 million, that is for the building and for all the equipment and for furniture and also all the autopsy equipment. It doesn't include engineering costs or construction management costs. So, and to your point, yes, there are, the autopsy rooms are designed to be autopsy rooms. So they have special ventilation, they have, it's kind of washing. So it draws the air in by the head and it goes up and then the fresh air comes down. So it creates a lack of a better word, a vortex or something that, controls the odors in the room and also, does the air exchanges, enough air exchanges an hour. And that is separate, of course, from the other part of the building that has, regular HVAC.
It's state of the art.
Yes.
The whole thing. One of the architectural companies we have working with us on this is also called Crime Lab Designs. And this is their specialty doing this. So the architect had subcontracted out Crime Lab Designs to come in and give their expertise on this. And I can tell you the conversations that were happening with all the architects, all the teams, and with the medical examiner's staff were actually inspiring to listen to. It has been one of the most pleasant experiences, and I think everybody would agree that's been part of this as far as just the sharing of information and understanding what everyone's needs are. No comment has been dismissed. So it's been enlightening to see all that.
The final question, do we have, how far in the process are we that you're looking at, like when an anticipated groundbreaking? And then the construction, what's the anticipation on the construction timeline?
We are waiting for the timeline now from the construction manager, but our goal is to get out the bid in August, this coming month. So that's, ambitious, but that is our goal. That's what we're working towards. So, and, that is attainable if all the pieces fall into place. There's, many moving parts right now, as there is with any large project. So, we're working through those now.
I want to thank you guys for
Thank you
getting
very
this
much.
legislative request through as you did.
Well, I want to thank you.
I just want to say that I
Legislative
think
staff, sorry.
Chris ran it through the department to department to department so that we could do this and get that bid to go out in August, so.
Yeah, we got word late that we had to come to this committee as well as physical service and ways and means with this request, so appreciate it.
That's out of the norm somewhat for three.
Very much. I try to keep it out of the norm for us. Last minute, believe me, because I have people over here that this.
We keep you on your agenda.
I think we have one more question from legislator Amos.
Brian, I think you mentioned something I wasn't really processing. You said there's autopsy room plus a special autopsy room.
Yes.
Explain the special.
So the special autopsy room would be, and Chris may expand on this, if there's an infectious disease or something else that comes in, they can be quarantined in that room and, you can still use the other part of the facility, the main autopsy room.
Next question, in your planning process with the consultants, did anybody from Pure Show participate in that discussion?
Not to my, no.
Not with the county construction projects on there. When we initially did the needs assessment and those types of things, they were absolutely involved. Yes, but once this became a county project internally, it was county staff working on those parts of it.
I know I wasn't called as a county representative of that village. I wasn't.
Right.
How you got with that?
They did the needs assessment. I remember that
That's different. Well, that's different. I'm talking about, did you bring in somebody and said, I mean, if you want to know something, just so anybody's interested, Dr. Sam Howland, who teaches at CUNY, been up here a couple of times to lecture, and he's a well-known guy. He's got a book out. It's called, When a Jew Dies. And if you don't know much about that, you should pick up that book, because if you haven't read it, it really is detailed in terms of the kind of questions you were raising about.
That's why I was asking those questions.
It's very detailed. If you're not familiar with the book, it's an easy read, but it's something I really had to wake up on. I picked it up and it's a really detailed process and,
Mhm.
and we're putting $21 million into the building and we haven't thought about when a Jew dies. And we've got 36,000 Curious Joel residents today, projected out to 26, we're gonna see 70,000. You're going to have a problem, and if you haven't dealt with specifically with the process of when the Jew dies, and it may affect you, and had your consultants having to walk over there and sit down with them. And I think I'd be a little concerned about that. Makes me a little anxious. I'm not saying, everything I've heard is a great building, but this is a very unique subpopulation that
I just want to add something though too. When I first started to say before about the needs assessment, I was aware that the funeral directors and I was under the impression that there was someone that would be there from, not possibly you, but someone else that would have been there from our neighbors,
I'll find out.
our other neighbors, but legislative, Chairwoman Benelli,
Thank you.
next.
Before we actually started to move forward in a continuing basis with the medical examiner's building, there had been some issues with having to respect and comply with the cultural regulations that were to be followed. And Michael, you'll probably remember in that we did have some individuals that were very familiar with that. I think some of them were EMTs, and we did have a meeting. I don't know if you were involved at that time, Chris, or others, but we had talked about the need. First of all, we obviously recognized if we needed a new facility. And when we built the new facility, this was something, as Legislator Amon just said, we have to prepare for that population. And this is something that building should provide. So I just went along thinking that this is taken care of with the different viewing rooms you've provided and things for that.
Absolutely.
If that's not the case, then we need to make some serious adjustments pretty quickly.
Yeah, yeah.
But
And again,
I
I'll get,
believe it is.
Yeah.
I really do. In the presentations, and we've been to a few of them, I don't have the pamphlet in front of me that we looked at the schematics before. So I want to believe that it's there as far as the specifics, but since it's a question now, it would be very helpful to have that. confirmed. I
absolutely,
appreciate
Chairwoman, I will get that information to you tomorrow.
That's
Okay,
great. Thank you.
Mr. Jones, that
That's
was
why I asked that.
that was the genesis of my, oftentimes, some have been involved in the lives of building. Say you have involved, the concept, and then you get on, and when it hits the final step and you unlock the door, somebody forgot to do something, or something wasn't done, they got lost in the weeds. And I'm just asking the question, when I heard your comment about, well, you weren't sure, I got to worry a little bit about it.
Sure.
I said, let's ask the people that are gonna use it. Brother Rabbi from Kenneth Shoulder can over and talk to you, get them, sit down and say, okay, here's what we got. Is there anything you see here, your problem?
Yes, so we
There may
have,
be another religion too, just to be sure we're covered. And it could be very, it could be just, and I don't think it has to be anything fancy. I think we just have to be sure we understand.
Right, absolutely.
Because, trying to fix it after it's over.
No.
Is not the way it ought to go.
and we have the bids not going out till August, so another month, so we make sure we
I
just
think
check that
it's
box.
also something that, where you may not see it in the physical, I think the security issues that you bring up, Chris, are very important. And I think that that's the way it has to be addressed as far as access with that type of thing.
And it may be very well addressed from just an operational standpoint.
Absolutely,
and
not necessarily from the
Not
structures.
physical, right, not from a physical standpoint. So, operationally, again, if it was one of those situations where someone had to stay overnight and someone had to stay next to the body, in the viewing room, that type of thing, maybe we would have to have a security guide
Yes.
on call all night there, whatever it is. Again, that's operationally not
But
something.
that's
physical.
operational.
Yes.
As I said, I don't think that that there's anything
Right.
that's compromised as far as this
Sure.
plant structure is concerned.
No, I would not
I
think so.
think it's really the implementation and how we make
Absolutely.
that happen.
I think it's mind-boggling when you think about, when you think about the projections that the county executives, consultants made when they're dealing with the annexation, 75,000 residents in Curious Joel within the next 10 years. And they were talking about, it could even get bigger.
Yeah.
And we got So which could be as much as a third, 70%. Third, almost a third of your population in the county, and you also have to know that so many of them are aging because, of Holocaust and they're aging people. And a lot of younger, you just may run into problems, but that's a large number of one group of people. They have demands on operation and physical plan. It'd be better to dot the I and cross the T. Not suggesting you didn't do it, I'm just want to make sure you probably go forward with this.
Chris, I think it's pretty obvious, but I have a quick question about who exactly are going to the ward. I would think accidents.
There is, I don't have the specific list in front of me, but there are unattended deaths, car accidents.
Unattended deaths.
Yes, unattended.
Unattended.
Unattended
Okay,
deaths,
unattended, yeah.
Yes.
Okay.
There is an entire list, I could pull that up and send that to you, but when an autopsy is needed.
I forgot about that, the unattended deaths. All right, everybody okay?
So you need a.
Yeah. All right, no more, any questions or other comments? Not all in question, all in favor, aye?
Aye.
Any opposed?
Mr. Chairman, I'll abstain until I get this information.
Okay, you have that, Doreen?
Yes, I do.
Okay,
Thank you.
okay. Motion passes, that's it, the desk is cleared and I'll take a motion to.
Yes, his report.
Do you want to report?
Oh, geez, all right. I do this every month.
I know, you forget up my operational report.
I know, all right, let's go.
Thank you.
Thank you, Brian. Thank you. Wouldn't want to stay?
No.
It's the good part. Yeah, I mean, the report that you guys have all been sent, this again is our busy time of year in the Department of Health with our Environmental Health Division. Lots of activity going on there. We are working 7 days a week with children's camp, summer activities and all those sorts of things. Wastewater COVID project continues to go on. We're very excited about that. We're excited about the technology, quite honestly, and where we see this technology going with analysis of wastewater. We're seeing a lot of indicators that science is now allowing us to potentially look for other types of diseases in there also, which would give us a little heads up in the future. So that's pretty exciting news just from a scientific standpoint. We're seeing that even to the aspect of possibly even flu and flu variants and being able to say, hey, maybe this type of vaccine will work better here and this type maybe work here. It's really amazing. Our COVID vaccinations are being done continually still by appointment only in Newburgh and Middletown offices. We do give vaccinations and booster vaccinations to our home residents when needed. Our listening sessions that we've been talking about over the past few sessions here that have been going out there, we concluded with them. They were a fantastic opportunity again for us to get out there with the public and to talk to them about different things and different needs that they have. And again, this data is being used to help compile our community health assessment and dictate the priority needs in our community health improvement plan. We did hold our health summit on June 28th. We had over 100 participants in that. This was, again, a great place for all people to kind of get together who had concerns about their communities and sort of rate rank their issues of what they thought was most important. And it's from this that we start developing, again, that community health improvement plan. We're happy to announce right now, again, that there is no monkeypox in Orange County. There are suspected cases in it in different places in Orange County. But we don't have any confirmed positives right now. Again, that could change, daily. So, and there's lots of really good information on that. I was going to send you some stuff, but my day kind of got away from me today. I'm going to email this to Doreen later. There's some great monkeypox talking points that I'd like to get out to everybody. There is also something that the governor's office put out. It's a text information line. And what will happen is you will get updated to your phone if there are any changes in the monkeypox conditions throughout the state or in this area. So it's a text to your phone that you can also sign up for. So I'll get both of those pieces of information out to Doreen, and she'll get that out to you regarding that. But again, it is something that we're very closely monitoring. COVID report, the data there is as you see, total deaths so far in the county from COVID are 1,182. We did see there's a slight decrease in the numbers with the rolling case average from the previous week. But again, looks like we're staying around the 140 cases per day, somewhere around there. So it's definitely still out there. We ask people to be careful and use their normal precautions and get vaccinated and get their boosters and get their double boosters and all those types of things if you haven't already. Take any questions.
Yes.
So one question, thank you, Mr. Chairman. On the wastewater analysis, who are you sharing the information
The
with?
waste,
Because being an EMS provider, it might be nice to know ahead of time, because obviously someone knows,
yeah.
but we don't know.
Yeah, so it's public information, actually. There's actually a link to go on and to see all of the data for every single wastewater treatment plant that is in New York State.
So
That
it's
is being-
weekly that we can look at it, or when is this update?
It is updated, it's not updated by us, it's updated at the state level. Typically, it's updated weekly, yeah. And so
Your information is only shared with the state, it's not shared with.
But no. So our information, so what happens is we do the sample, we're going to do the sample analysis. We supply the bottles, right, to the wastewater treatment plants, the 6 that we're doing. The operators of the wastewater treatment plants send those bottles up to a laboratory, right? Not even to us. The data is the data. The analysis is completed. And that goes to the State Department of Health. The State Department of Health does send us reports on it. It's a little bit, it's not kind of user-friendly or easy to decode. I wouldn't say it's not in layman's terms type stuff. But that data is then put onto a dashboard, New York State dashboard, where anybody can have access to that anytime they want, and to look at the data and to see the trends, and to see the graphs and how they're all going, to see, and you can compare the data coming out of the wastewater treatment plant to the actual number of positive cases in that same area.
What do you think the time frame is? Because we're looking for, someone knows a week ahead that there's gonna be a little outbreak.
Yeah.
Those should say, we wanna know about it.
Yeah.
But we don't really have a way of knowing other than the state, I guess.
I mean, the best way is you can look at that when that dashboard was not as savvy and as accurate as it is right now. What we would do is we would actually give some reports to hospitals. So if we saw a spike, for example, coming up in the wastewater, we would notify, for example, St. Luke's was always curious, down there. It's like, what's the data look like? Are we gonna see an increase in the next 10 days? So we would, on a regular basis, at one point, we would say, hey, this is going up, and we would also notify municipal leaders about this. Now we send them the link, and I'd be happy again to get that link out to everybody here, just so you can look yourself and see exactly what's happening there.
Yeah, definitely send that.
Yeah.
If you could send that along to us.
Yeah,
A lot of homework.
I'll put, no.
Yeah.
That's it. Is that all you have, Chris?
That's all I got.
That's enough. Any questions or comments? All right. Thank you very much.
Yes, thank you very much. Yep.
Take a motion to adjourn now.
Second.
Everyone.
Take care, Kevin.
Ladies, gentlemen.
Looks like it is, yep.
You're welcome. Thank you.